Hello and welcome to Notts Today, the show bringing you the matters that matter to you with me, Emma Caldwell. Here's a look at what's coming up on the show this evening. Only 30% of water in Nottinghamshire is fluoridated, which means those receiving the other 70% of water are at risk of dental decay. That's according to Conservative Nottinghamshire County Councillor Dr John Doddy, who's leading a campaign for the fluoridation of drinking water in Notts. And fluoride is a natural mineral that can help prevent tooth decay. It's added in toothpaste and some foods, and he says it's a preventable health inequality that hasn't been talked about for almost 40 years. And since fluoride was added to some northern areas of the county, John presented a motion to the council which has now been passed and is gaining more support as the campaign continues.
I bring before you is a motion that highlights the oral health challenge of the people of Nottinghamshire. And not just the oral health challenge, but the fact that it's preventable, the fact that it's a genuine health inequality, and the fact that it can be largely dealt with by fluoridation of the water supply. All I'm asking for you today is to put your faith in me as the chair of the Health and Wellbeing Board to bring this argument forward, to bring together the ICSs and the ICBs, to bring together councils, not just in Nottinghamshire, but across the city of Nottingham and into the wider area to culminate in an improvement in the oral health of the people of Nottinghamshire, and to bring me directly to the door of the Secretary of State for Health and ask him to fluoridate the water of Nottinghamshire.
And joining me now to tell us more is Dr John Doddy himself. John, thank you so much for coming in today. First of all, why is fluoride so important for our teeth?
I think put into context that the fact that we have some of the greatest numbers of kids having dental caries and needing teeth removed often in hospital under anaesthetic, it's focused everybody's attentions on the importance of strong, healthy teeth. In order to have strong, healthy teeth, fluoride is put in water, absorbed into the body, goes through the body interestingly, comes out in your saliva, acts on the bacteria that break down teeth and cause dental decay and reduce the amount of dental caries children have, particularly the under fives, by up to a third. Imagine any other intervention in history that could reduce disease by a third simply by adding fluoride.
And why has it got to the point in Nottinghamshire life that only 30% of our water has fluoride in it? You would think that it was all or nothing. How come only 30%?
You probably have to go back to the 1970s because 40 years ago was the last time anybody added fluoride to water. Now obviously they picked areas and added the fluoride, and then social attitudes changed. And for 40 years I think either people were under the illusion that their teeth had gotten healthier, that they were living better lives, that they could get access to a dentist, that they now had fluoridated toothpaste. For whatever reason, they were lulled into this sense of false security that things had improved. But post-COVID, having had no dental appointments during COVID, kids now, through cost of living crisis, not being able to afford toothbrushes and toothpastes, masses of people, 38,000 of them get admitted to hospital for dental clear-outs under anaesthetics. The focus has shifted enormously to say, what can we do? And the single biggest public health intervention that you could possibly do would be simply to add fluoride to the drinking water. What could be simpler?
I mean, it does sound like a simple solution.
Yes.
What would the process be to add it to our water? Is it as simple as someone sort of adds it to the water at the source and then it comes out of our tap in Nottinghamshire?
You mean like going on Amazon Prime and just
ordering it in?
Next day delivery. It has been simplified. Last year in 2022, July, a government act came in that said one man has total responsibility for all of the fluoridation of the whole of the UK. That is the Secretary of State for Health, Steve Barclay. I met with Steve Barclay and I've already informed him that I'm coming down to get the water fluoridated in Nottinghamshire. And it's a case of the population of Nottinghamshire coming together through the county council, through the NHS, through the various community sectors and saying, we're ready to be fluoridated. You go down to Steve Barclay and say, we'd like it fluoridated. He then has to do a public consultation to check that's okay. Then he has to go to the water boards. Then they have to look at the equipment that's required to monitor the mixture of the fluoride, so it's 1 part per million, and then over a period of months or even years to decide where it's going to happen and then put it into action. But it would be the same as building an M1 motorway. It would be the same as building a HS2 or something like that. You just got to make the decision. You just got to bite the bullet. You've got to put the children first in this challenging times that we've got and fluoridate the water. Somebody needs to lead it. Somebody needs to stand up and say, now is the moment. And that's what I'm doing. I'm saying to Steve Barclay, to the country, to Nottinghamshire, now is the moment.
And how do you tell if you're one of the 30% in Nottinghamshire that has fluoride in the water? I remember the difference of my nan and granddad's water. They lived in Aspley in Nottingham, and I could almost taste the difference, and I'm sure it was because it had fluoride in and ours maybe didn't. How do you tell?
Well, you would be a truly remarkable, unique individual. You'd be like a sniffer dog at an airport sorting out drugs. I think it is quite unique that if I took the population of Mansfield and I took a similar population demographically and economically like Boston, which isn't fluoridated, and I asked both populations, you know, is your water fluoridated? They don't know.
You don't know.
Every single person that I ask thinks their water is fluoridated, but they haven't got a clue. And isn't that so amazing that for 40 years we could have fluoridated a third of the population of Nottinghamshire and they haven't got a clue. Now the other thing that tells you is that there hasn't been a single adverse effect from fluoridation over those 40 years. In all the studies that have been done, has one person come forward and said, oh, that fluoridation hasn't suited me, Dr. Doddy? No.
So that was going to be my next question.
Yes.
Is there any reason why people might not want fluoride in their water?
There was a period of time when fluoridation started in America in the 1940s and came over here in the 1960s. America got up to 66%.
Yeah.
We're at 10%. So over a period of time, some people might feel that it's their responsibility to look after their own teeth and it's not for the government to interfere and put fluoride in the water. Some people might say, hey, hang on a minute, I've read about these side effects. People have read about in New Delhi where kids were taught to have an underactive thyroid on a more often basis than not.
Oh, I'm so sorry, Doctor. I'm going to have to stop you there, but come back and tell us more about it.
I'll come back, and if anybody needs more information, just Dr. Doddy, Nottinghamshire County Council. I'll give you all the information you need.
Amazing. Thank you so much for your time.